right, reel them in. Reel them in. That's it. Reel them in. Because today you are all about to land an amazing catch. We are diving into the Australian healthcare system, and trust us, by the end of this presentation, you'll be hooked with facts, amazing insights, and an overall better understanding of what the system in Australia has to offer and what it does not have to offer as well. So I'm going to get us started off with Quincy Little, who is going to tell us what the current state of the Australian healthcare system is. Take it away, please, Quincy.
Thank you, Christian. Well, the current state of the Australian healthcare system is majorly quite good. So there's a mix between public and private healthcare, which is funded through federal government funding, state and territory governments, private health insurance, and the overall out-of-pocket patient payments that are specifically through the private health funds. So these can cover a range of different services like hospitals, GP, specialists, and the kind of overall allied health professionals such as chiropractors. The main differences in the structures of the two is that public healthcare is free or a low-cost treatment through Medicare, and it has accessibility to all Australian citizens or permanent residents. Whilst comparatively, private healthcare provides a faster outcome that is more expensive and is a paid alternative, giving a greater choice of doctors and hospitals due to this paid element. However, the main concern within the Australian healthcare system specifically is our aging population, with by 2050 nearly 9 million Australians being aged 65 and over, making up over about 25% of the total population. So this aging population is increasing the demand for healthcare services, especially within the more densely populated areas, having more chronic disease management, aged care, and hospital resources. So this growing pressure on healthcare funding and workforce availability is due to this overall increased life expectancy. However, there are also higher rates of chronic diseases such as arthritis, cardiovascular diseases, diabetes, and overall dementia becoming more common within older Australians. However, the main outcomes and gaps as well within the healthcare system, which we'll be talking about today, is the growing shortages of nurses, doctors, and allied health professionals. The healthcare work is becoming more burnt out, especially prior to COVID-19. Increased demand, placing pressure on hospitals and emergency services, and the overall reliance on overseas trained healthcare workers due to our multiculturality of Australia. So overall, we are doing quite well. However, we definitely have places to go. And to compare us to the other countries is Christian with the next slide.
Thank you, Quincy, for handing it over to me, because what I have for you guys is a jam-packed, stat-filled analysis on how Australia compares to other countries, and more specifically, OECD countries. So, what does OECD stand for? Well, it stands for the Organization for Economic Cooperation and Development. So basically, it's an international group of countries that work together to improve their economies and people's quality of life. But for the sake of this presentation, I'm just going to refer to it as an organization, as it is quite annoying to say OECD. So how does Australia compare to the organization? Well, Australia's healthcare system generally performs better on average than the countries within the organization. Some key categories that stand out is higher life expectancy. Australians live to about 83 years compared to the organization's average of 81, giving it a slight edge over a couple of others, and also with lower preventable deaths. So Australia records around 99 preventable deaths per 100,000 people, which is significantly lower than the organization's average of 145. So that is a massive pro for Australia. Australia also has strong healthcare workers and overall strong healthcare workforce. So Australia has more nurses and slightly more doctors per person than the organization's average. And also what Quincy touched upon with Medicare, Australia has a universal healthcare system. So Australians have broad access to public healthcare services, unlike some other countries, such as the US, which does stand out a lot more because the US has a significant number of people compared to Australia. It's been over 320 million, and Australia just being over 25 million. So to have that public healthcare with such a difference in population is quite huge for Australia. Australia also spends more on healthcare system than lots of other countries within the organisation, being at around 10.3% of its GDP spent on healthcare, compared to the average of the organisation, which is 9.3%. So to put that into a picture, Australia spends about $7,469 per person, that's USD, above the organisation's average of $5,967 USD. So within this, where does Australia stand? So with life expectancy again, as you can see on the graph listed there, Australia is much higher, actually ranking third overall with life expectancy, just below Switzerland and Japan. So putting that into perspective, a lot of these countries within the organization are within Europe, which have that stereotype of having a high life expectancy. So for Australia to be third is quite significant and huge for its healthcare system overall. Now, I am going to hand over to Charlie, who's going to tell us about the strengths about what Australia gets right within its healthcare system.
All right, thank you, boys. So I'm going to be talking about first what Australia gets right. So the Australian healthcare system is seen as better performing compared to other countries, as it's built on its public health insurance scheme known as Medicare, as well as its private sector, which Quincy already spoke about. This is a result of deliberate decade-long commitment to universal public health care. It's backed by a strong primary care system. Due to this, Australia ranks top 10 countries globally overall every year in its system and outcomes. As well as this, the Pharmaceutical Benefits Scheme makes medication that wouldn't be affordable or possibly inaccessible in other countries available to almost everyone whenever it is needed. Australia's strong primary care foundation allows for GPs to be the first point of contact, which also helps avoid specialist appointments if they're not needed and put less pressure on specialists. So now onto the cons. The cost pressures are real, and within an aging population and rising risks of chronic disease, meaning we're spending more without always spending smarter. Bulk billing rates are falling, causing more Australians to pay out of pocket just to see their GP. Public hospital wait times remain stubbornly long, and ambulance services aren't even included in Medicare at all. Routine dental care is another gap that surprises people, but it's not included. And out-of-pocket costs are needed for these things. So despite it being essential overall health, it's largely excluded. Mental health is also really underfunded in Australia in a way that is increasingly hard to justify, because 1 in 5 Australians aged 16 to 65 experience a mental disorder in any given year, which gives all Australians around a 43% chance of experiencing a mental illness in their lifetime. So the demand is enormous. These services aren't keeping pace. Then there's geography. Rural and remote communities face real shortages of GPs and specialists. And for the First Nations Australians, the barriers go even deeper. 1 in 8 Australians, Indigenous Australians, do not have access to healthcare when needed. This is due to a combination of distance, cost, and lack of culturally safe care. This is a systematic failure, not an individual one. So now I'm going to go on to Quincy and Christian. They're going to talk about the recommendations for our path forward.
Thank you, Charlie. Yeah, so as a group, we were looking for the recommendation. We had to specify one specific area. And the kind of part that Charlie touched on just before was talking about the rural areas specifically, and how there is quite a demand for a greater healthcare out there. And so as a group, we were looking to expand the rural workforce incentives to get more healthcare workers out there and helping those communities. So this will impact quite beneficially for this area, especially within the short term, having the increased workforce, having shorter waiting times within these health areas, having more access to specialists as there'll be more doctors around, and overall creating a greater health outcome physically and mentally within these rural communities. And then overall, within the longer term, there'll be a greater retention of healthcare workers within these regional areas over time, as there will be targeted scholarships, or other relocation support that will help to address these major issues. However, thus, with any decision we make, there was obviously considerations. So we addressed that there'd be definitely cost problems with expensive incentives that would need to get people over to these hard places to get to. And also with the greater workforce, there is the major risk that there may be reduced quality. However, how these considerations affect each stakeholder, Christian will talk about that now.
I will be talking about the stakeholder perspective, and more specifically the healthcare providers. So, as Quincy touched on before, and Charlie, within the healthcare providers in a lot of rural areas, there's just a significant lack of healthcare workers in general, which does significantly impact these smaller communities, especially out in rural Northern Territory, WA, Queensland, and really just in every single state that has those isolated communities. It really does affect each and every person, even like with towns such as Benalla, Wangaratta, for example, that sort of have around 10 to 20,000 people. Having that lack of healthcare just, overall has a negative impact and leads to more patients getting sent to Melbourne, which is, another 3-hour drive, or on the helicopter, and it's just keeps adding up, really. So if we can, sort of just have that funding, have that more of like the better infrastructure within the rural communities, it can really make a huge difference to these places that need it the most, really. But overall, that is what needs to be done for the healthcare providers. So seeking adequate funding, reduce administrative burden, and safe staff rotation. So always having that rotation between healthcare workers and making sure they are working under their best possible ways and conditions as well. Now I will get Charlie to talk about the patients and communities. Thank you, Charlie.
Thanks, Christian. So for patients and communities, expanding rural workforce incentives would have the most positive impact on them, because it's going to provide these Australians with a greater quality of life. They're going to have more access. It's going to be more affordable healthcare, especially because they're not going to have to be traveling as far. Specifically Indigenous communities as well. So it's going to boost the economy a lot. The only downside for patients is probably the higher risk of quality issues. So prioritizing timely access, affordability, and culturally appropriate care for these Australians.
Yeah, thank you, Charlie. And I think ultimately the final stakeholder here is the government, because it kind of comes down to their decision making. And I think this will be really beneficial for them, because especially with brand imaging, this will definitely give them a good image of helping out the community and helping out the less dense areas that are normally have the most prioritized towards. However, with this good brand imaging, it does bring the risks that it may be seen as kind of looking to put this healthcare and all this money into a smaller population of Australia, as the more densely populated areas may be where prioritization must be. But overall, I think it's important to take all this into consideration for the government. And I think we as a group think that the pros outweigh the cons here, and that it could be very beneficial for the little guy here and help out the more rural Australia. Thank you.
Absolutely, Quincy, you're absolutely spot on there. Also, just wanted to touch back on, even though Australia is spending a significant amount on its healthcare within its GDP, being 10.3%, which is what we're spending currently. Even just boosting that up to that 15% mark, even 20%. I know it's asking a lot, but healthcare ultimately is, decides and determines really how Australians function, go about their everyday lives. It's between that going to work, not being able to work, having that annual leave and everything. It's ultimately what keeps this country running and this economy going is healthcare, and we just need to do a lot more about it. But ultimately lots of pros going this way of the country. But just some things that we need to tidy up. But overall, Australia is looking really good and in a very good spot. So thank you both.
Thank you, Christian, for that. Yeah.
Thank you, Christian.
Awesome. Thanks, Charlie. Thank you, Quincy.
Hope you guys got a nice catch.
Got a very big catch today. We are all winners here at the Australian Chiropractic College. Thank you for our group presentation presented by Charlie, Quincy, and myself. We all worked very hard towards this and are very grateful for the viewer. Yeah, so please
hit the notification bell for more videos like this, and we will see you later. Thank you, Kay. Thank you.
reference list is below.